this in the schedule, we thought, well, okay, we know we're going to be, busy this September, but we're going to put it on the agenda, and we'll see if we get maybe 15, 20 people to show up. Well, we have about 100 people who are signed up. They're not all here yet, but that's just fabulous. And it shows the dedication to your profession by students and practitioners, and it also shows that you care about what happens to the public policy that affects your profession and the people that you serve. That's an important part of your message today when you patients you serve, and that's one of the reasons why I love working for occupational therapy. That's what you think about, that's what you care about, not only about yourselves, but about the people that you help to live their lives to the fullest. I just want to say thank you to the staff of the Public Affairs Division, Tim Nanoff, Dan Jones, Darlene Dennis, who's not here with us today, she's ill, Rachel Roberts back at the office.
And one of them is to talk about OT, and be able to connect with that staff member or the member of Congress to the district. If you work in a school setting or a hospital, talk about that hospital, the patients that you see there, what good. And again, Barbara's going to be able to go over a little bit, really the best ways to talk about OT to staff members or to non-OTs for that matter. The second thing that we would want you to talk about in here, we are underneath a therapy cap exceptions process right now that was enacted in the Tax Relief and Healthcare Act of 2006. So this past December, Congress passed a bill that extended an alternative process to having the caps implemented for this year, for 2007, much like they did for that 1 year prior, 2000. You can see from the, well, if you don't have the fact sheet yet, it's in the white and the yellow folder, that asks for the repeal of the therapy cap legislation. To go ahead and get rid of the legislation altogether. And we have always supported that. And you can ask your members of Congress to be, or Tim, do you want to go over the S-chip legislation as well as the backpack bill?
One of the questions you might get when you're in the Capitol Hill offices are that there's a piece of legislation out there that's passed the House, it's passed the Senate, but it's called S-chip, or the State Children's Health Insurance Program. The program is up for reauthorization, and both the House and the Senate have passed their own versions, which is great. The challenging part is that the versions are very different. The Senate included own legislation that affects both Medicare, Medicaid, and S-chip. We take a very straightforward position on it. You have it in your yellow packet, which you're going to pick up. You're going to have information about S-chip in general, and it talks specifically about the program of children's health insurance. And we support both the House and the Senate versions of the bill, and our position is that we're asking that they reauthorize it and improve the program. Some basics that are common to both pieces of legislation. There's at least $35 billion in new spending for children's health insurance. The House version has $50 billion in new spending, the Senate has $35, but either way, they're both an improvement, so we support them. Both of them extend mental health parity to the S-chip program, which is very important for all the different people who are covered by it, overwhelmingly under low-income children. They improve dental coverage under S-chip, and they require that services be specific and measurable, which is very, very helpful to the program in creating evidence-based practice. The House bill addresses Medicare as well. It addresses the therapy cap issue, and it provides a 2-year extension. It provides the basic information that I just talked about, as well as the Medicare provision at the bottom. The Medicare provisions are a little bit of a touchy issue in some technical areas, but the talking points you have here make it clear what AOTA's position is. Finally, I just wanted to touch base with you about the backpack day, which is schools. So your folder that you have that you're going to be keeping with you throughout the day should remind you to discuss backpack day, since it has our poster there in the front of it. And you also have a front and back page handout. that discusses Backpack Day. So if you can just mention that at your meetings, just that occupational therapy is promoting Wednesday the 19th is National School Backpack Awareness Day, and the role of occupational therapists in schools and helping kids to perform better to their highest level of performance. That would be great. Right now you'll see up here, to my right, there are, you know, we gave you a couple of very specific legislative issues to talk about because they're timely right now, but we understand that your interest might be much broader than that. We have issues up here that range from school-based services to appropriations for a particular area that you might be interested in, particularly if you're in school. There's Title VII funding, which has to do with grants for education for allied health professionals like occupational therapists. So I'm just going to give a quick rundown of these issues. We're not going to discuss them in detail, but when we're finished, Dan and I would be happy to stand here and talk to you about any specifics that you want to share in your meetings. So when you go to your meetings, if you talk about the two things that we've included, or the three things, occupational therapy in general, therapy caps, and then the S-chip bill, that area of practice. And the ones that we've included are Medicaid and occupational therapy. Occupational therapy's role in prevention and wellness, and there are several different pieces of legislation under several of these bills. So if you are interested, you can come grab one of these when we're finished. Occupational therapy in schools and early intervention settings, the 75% rule for inpatient rehabilitation facilities, occupational therapy in veterans health care rather than having it be billed by an occupational therapist specifically. It's an issue that we have that's very hot on. It's a concern to AOTA. It's not actually moving very quickly in the House, so we're very glad about that. Occupational therapy and mental health, as well as home health. Those are all the different factions that we have up here.
But like I said, the best thing that you can do is be concise in your meetings to be as efficient and as effective as possible. Once your meeting is done, you can thank them for their meeting, and the most important part will be the follow-up, whether it be tomorrow or 2 days from now or next week. That will give you their contact information. And we also would like for you to send Tim or I an email at djones@aota.org or tnanoff@aota.org, and let us know how your meeting went and if there's any need for follow-up on our end. I think an important point to make is if you get asked a question that you're not sure what the answer is, which sometimes you may find a staff member that is very knowledgeable about some of the issues that you may be talking about, don't feel intimidated.